Please start. Maynard, you can start. Thank you.
Good afternoon, everyone from Bangkok, Thailand. My name is Midnight. I am so proud to be working with a team from APCOM to help host this regional Asia Pacific webinar on scaling up HIV self-testing for key populations. Thank you so much for joining us from wherever you are. And I hope that you will have a really good Friday to learn about what's happening within the region to ensure that HIV self-testing will empower particularly key populations within our region to know their HIV status, wherever they are and whenever they want. We know that it is quick and easy and that you have privacy to be able to do this. And we want to encourage as many people as possible to know their HIV status earlier and then be able to be linked to services that they might need. Of course, our webinar would not be possible without the collaboration from so many different organizations, but the partnership that we have with PEPFAR, USAID, and EPIC has been the one that helped ensure the regional webinars we've been having the past few months. So thank you so much for the ongoing collaboration, PEPFAR, USAID, and EPIC. We also want to recognize that there are other partners as well that want to learn from many other different countries. And we also have a session on the country experiences that will be sharing with us from Indonesia, from Spiritual Foundation, from Laos, the EPIC in Laos. From Malaysia, we have the Malaysian AIDS Council. And then from just here in Thailand, from the Institute of HIV Research and Innovation. I also want to acknowledge our partnership that we have with UNAIDS and WHO that will be giving us an updated guidelines on the HIV self-testing and other innovations on self-testing that we have globally and how that is being implemented in our region. We also have really great remarks from the government of Cambodia. So Dr. Ngau Bora, Deputy Director of NCHAS, will also be giving us an opening remarks. But before we go to that, can I just get some housekeeping slide? Great. So as you can see here, please do introduce yourself by changing your name to organization and country to the to your Zoom name, and then also feel free to introduce yourself in the chat box. The webinar is recorded and will be conducted in English. So we'll be able to share this with you, or you can share it with your colleagues that are not able to join us today. Please do ensure that you keep your microphone on mute at all times, and except when you are speaking. There will be some allocated time for Q&A, but if you want to ask questions, you can raise your hands and speak, or you can also write your questions in the chat function as well. And please, though, the speakers, if you see questions that might be relevant to you, feel free to answer them in the chat box as well. And then I think we're so familiar now with all the Zoom functions, but there is the applause, there's the heart function, thumbs up. So please feel free to use that. We know that it's good to kind of get the encouragement from everyone within the room, and you can feel much more involved in the conversation as well. If you want to tweet or take a screenshot of today's session, please ensure that you ask permission from the contributors as well, or before quoting them and sharing the screenshot. And then, of course, reminder to be respectful in every aspect in this discussion, particularly to all the speakers and participants. This is a safe space for everyone to come together, to learn, to discuss, and appreciate each other's efforts, and of course, celebrate each other's contributions as well. It's tough situations, particularly because of the pandemic and all the other going on around the world. But we hope that this is the start of conversation to ensure that we have much further conversation around scaling up of HIV self-testing for our region. Thank you very much, team, for sharing the housekeeping. And without further ado, I'd like to give the next the mic to the opening remarks by Dr. Pimpanita Sanyakun, who is the HIV Deputy Team Leader of the Office of Public Health in USAID, the RDMA based in Bangkok, Thailand. Thank you so much. Over to you, Kap.
ขอบคุณค่ะ Thank you so much. Good afternoon, good morning, everyone. It is my honor to join distinguished guests. Thank you for speakers from WHO, UNAIDS in Cambodia, Haram, Indonesia, Laos, Malaysia, and Thailand. And thank you for Khun Midnight, Executive Director from APCOM, for conducting this important critical HIV self-test webinar. And also thank you for a very welcome for honor 57 guests from EPIC project, CSO implementing partners from Burma, Cambodia, Laos, Philippines, Indonesia, and Kyrgyzstan, Vietnam, and Thailand. So my name is Pimpanita Sanyakun, or Grace Guide. I'm the HIV Deputy Team Leader of the USAID PEPFAR team, Office of Public Health at USAID Regional Development Mission of Asia. So in 2021, there were an estimate of 6 million people living with HIV in Asia Pacific region, and they were estimated around 260,000 new infections, and 76 of people living with HIV in Asia Pacific were diagnosed. However, another 24% of people living with HIV were not diagnosed, and 2/3 of them or people living with HIV were on treatment, while another 34% were not yet access to HIV treatment yet. So the vast majority of new infections were among key population and their partners. And 1/4 of new HIV cases in this region last year were young people, aged 15 to 24, mostly key populations, like 99%, something like that. So HIV and WHO also recommended that HIV self-test is a safe procedure, accurate and effective way to reach people with may not have to know their status yet. Also, the new PEPFAR 5x3 strategies, as you might have learned sometimes already, indicate it is critical to follow up the science to action for the global community to stop HIV infection, in particular among young people. So ending AIDS in young generations is a priority, and we need to work with local governments and international partners to share technical information to aid others in their responses, and continuously assess barriers to HIV testing, in particular HIV self-testing and device approaches where we can be the most effective to increase uptake linked to the National HIV Strategic Plan and WHO guidance, including lessons learned during the COVID-19 pandemic to enhance HIV self-testing among key and vulnerable populations. Communities have important lessons learned and to share that they will help to inform efforts. So the U.S. Agency for International Development, or USAID, is coordinating with our international partners, including Global Fund, UNAIDS, WHO, and other multilateral organizations and local partners to consider the best way to implement the latest WHO recommendations on HIV testing services and HIV self-testing, to learn from HIV self-test pilots in this region and strategize on integrating HIV self-tests into national programs and responses, which we will hear from today's speaking. USAID is pleased to support the webinar as an important means to sharing information and experiences to assist communities in preparing to rapidly scale up HIV self-test support ending AIDS in this region. We acknowledge that partnership is the underlying element of successful for infectious diseases efforts. I see this commitment today as technical and financial partners, as well as regional community-based organizations come together to learn about the discuss HIV epidemic control using HIV self-test as one of key strategies. I especially want to thank the leadership of our community partners, WHO and the UNAIDS regional support team and APCOM, for their support on this collaboration with our stakeholders to provide critical services for key populations. USAID is honored and grateful to be able to join this webinar and congratulate you on this initiative. Thank you so much. Thank you ค่ะคุณ APCOM
ขอบคุณครับ Thank you ครับ
คุณ
Dr.
Midnight
Guest Guide. Thank you so much for that opening remarks to remind us that for our region, it's about key populations and how do we actually ensure particularly young key populations have access to the HIV services. So there's a lot of work for us to do. Just a reminder that we will do a photo session right after the next opening remarks from the government of Cambodia. So please get your camera ready for the next for a group photo. So without further ado, I'd like to invite Dr. Ngau Bora from the Cambodia, who is the Deputy Director of NCHAT, to give an opening remark. So we're very honored to have the government of Cambodia to share about their policy implementation and results that Cambodia has done, and also the leadership on the HIV self-testing, and kind of also to say big welcome from all of us from the community, as Cambodia is now sitting as a member state on the UNAIDS Program Coordinating Board. Okuncharan, and over to you, Dr. Bora.
Thank you, Midnight, and good afternoon or good morning, everyone. It's time that my honor for today webinar. I would like to respect for APCOM, UNAIDS, and our team from many countries, include Burma, Laos, Malaysia, Philippines, Thai, Vietnam, and Cambodia. Actually, from our program here, we learned that the HIV cell testing is a good connection or good finding that we can find a lot of HIV positive case that help us for identify the new case finding for enrollment for care and treatment. From our side here, Cambodia have many challenging and not have more expert about that, but we just try to combine and include many methods that can identify HIV test case, include like partner testing, key population testing, so that we have many options that can patient or population can select or choose which one are preferable for them. And up to now in our Cambodia we have like 66,235 cases of the HIV patient are on treatment among 73 ART sites in countrywide. And of course, among these, we have like promote for the self-testing among those clinics for identify partner and provide the test kit to patient to bring this self-testing to the partner, so that I will get more result and feedback from those, and also found more positive case from this group too. And about another self-testing group that we provide to community also get a lot of feedback that we work smoothly and provide a lot of test kit that can help for identify HIV testing and status of our KP. Actually, for today, Babina, I wish to see all of our challenging and status that recommendation and challenging from our side, so that in this time I would like to share my slide presentation as you see here. Yeah, next slide, Midnight. Yeah, in this I have 3 or 4 content that will show you Cambodia priority to getting to the global target, and secondly HIV self-testing implementation result to that, and 3 key lesson learned, and 4 challenging and next step. Next. First one, talk about the Cambodia priority and to getting to the global target. As you know, Cambodia have recently been elected to a member of state on the UNAID PCB for 23 and 25. And Cambodia also achieved the 2020 fast track treatment target of 90 in 2017, and 3 years ahead of the global goal, and has made significant progress toward that achieve 95 target. And Cambodia is currently at 86, 99, and 98. And for priority, we prevent new HIV infection through combination HIV prevention with exploring adoption of innovation, CAP-LA or DBO. And we will fill a gap in 95, in particular, first 95, through differentiated and innovative HIV testing, including HIV cell testing, differentiated and optimal treatment and care services, and address inequality and barrier to access HIV service, include stigma and discrimination, and prepare for transition for sustainability of HIV response to. Next one. If we talk about the HIV self-testing implementation, next slide. We have the goal and objective that we plan to do that. Our goal is to contribute the elimination of new HIV infection and ending AIDS as a public health threat by 2025 for achieve 95 target. Through this and provision of alternative and more acceptable testing option for those at risk for HIV. And for our objective, we want to see the overall objective is to establish the policy and procedure around HIV testing rollout and implementation to create more HIV testing option to reduce the barrier and access HIV testing for anyone at risk for HIV. Actually, we have like HIV testing for provider assist and HIV testing virtually. Next slide. This data approach, HIV testing process is which an individual who want to know his or her HIV status collected the specimen, oral fluid or capillary blood by perform a test and interpret the result by him or herself. Often in this private, either alone or with someone he or her trust. Usually, with the reactive test result need to access HIV testing service to confirmatory test HIV using national HIV testing algorithm and link to care services. Next slide. And from this implementation, now we can see the coverage of the implementation for HIV testing that we since we introduced the HIV self-testing like last year, I mean, up to now, Q2 of 2020, we can see that 19 provinces implemented HIV testing among KP, MSM, TG, female sex worker, and TB, and 25 AT sites in the 8 provinces in Cambodia has integrated HIV testing in partner notification testing and tracing approach. And HIV testing kits currently sell to KP and other clients in 89 pharmacies, include 25 pharmacies partnership with the Spotlight in 11 provinces, include Phnom Penh City, Bat Bong, Prasian Nước Kampot, Posat Sindip, and Bat Tim Jay, Kandal, Cap Swahili, and Stone Tribe too. Next slide. This is the result. We can see that this can show the result of the enrollment and the testing. In the blue bar is the result of the testing, self-testing kit and testing all KP people from Q4 2020 up to Q1 2023. And we can see that the number of tests are increasing every quarter. And in Q1, I saw Q2 that the result of the test is higher than other quarter. And besides on that, we can smoothly increase. And the positive rate also flag on like and some decrease, yeah, in this quarter. Next slide. Yeah, this one the result of the test and positive rate by quarter. You can see that in Q2 2022 and 23, we can see the positive rate decreasing from around 20% up to 12.8 up to 7.1 somehow. Yeah. This one we can explain that female sex worker and MSM and TG are highly among those is a TG group that a lot of the positive, and MSM still like not more decrease, 7.6, 5.8, and 4.7. Next slide. For the PNTT, actually, I would like to let you know that PNTT cell testing, actually they did it in the AIT facility. Yeah. So that among 25 facility of AIT clinic, we implemented the HIV cell testing that using the partner notification testing tracing approach. So that we include 10 province that we can did it, and among these you can see 130 partner in there using the cell testing kit. This one talk about the Q4 of 22 to Q2 of 23 is result, and among these we can see 13.8% test rate positive among this group. Next slide. This will show you about the lesson learned, what and challenging that we facing in our here. Actually, HIV cell testing immediately include as part of our differentiated HIV cell testing. After a small study with the HIV cell testing SOP adopted by MOA in June 2020, and HIV cell testing helped us for identify first 90 for improved case detection through the rate of a new KP who not been read and tested before, and high yield of HIV cell testing is over 6%, and effective linkage to care, almost 100% confirmed HIV positive enrolled on ART, and collaboration with the CBO and relevant service provider are the key virus channel CBO community, in particularly through the virtual and AIT site and private pharmacy too. Slide. This one the challenge and next step. We have categorized with three. One is community and AIT service and pharmacy. So in the community, we have with demand of HIV cell testing. Promotion is being improved, and the HIV testing is not widely implementation up to speed for all KP due to the limit stock of HIV cell testing kit. And about the AIT service, our cell testing kit distribution demand low at AIT service for partner notification need to strengthen and to scale up more sites as soon as possible. And counseling skills are still limited related to providing HIV cell testing kit, and limit of promotion HIV cell testing, and the limit on-site support for ART PNTT for implementing HIV cell testing, and ART counselor or provider feel concerned to get HIV test result back from their client, therefore they limit for distribution. And about the pharmacy, we also limit the HIV cell testing promotion in the private sector, and knowledge for seller for provide information for clients still limited, and have to collect data from the company in terms of a number of HIV cell testing sold and client before. I think that's all from Cambodia slide, and thank you everyone, and welcome for your question, and we'll see your answer. Okay, thank you.
Thank you so much, Dr. Bora, for the opening remarks, and also sharing the experiences from Cambodia. It's astonishing to hear that you already have the HIV self-testing through community, virtual, and also through pharmacy in 19 provinces targeting at key populations. male sex women, transgender, female sex worker, and people who inject drugs. And then you also talk about the challenges in terms, particularly around the demand generation. I think that's really interesting. And Cambodia is doing really great already. And of course, there's still more that we could do. Thank you for sharing that. For all the participants, if you have any questions, please feel free to type in the chat box and the Q&A function. And as I mentioned, you can put your camera on. So we're going to go and have a group photo before we have another person join us to talk about the guidelines from WHO. So you can please have your camera on. Yeah, if you're comfortable to have your camera on, please have that on. And then look at the camera and not look at yourself on the screen. And then our team will do a countdown and then take some photos.
Okay. 1, 2, 3. One more. 1, 2. Smile. 3. Okay. Thank you.
Well, thank you so much. For showing your smiley faces. It's great to see people behind the screen. And without further ado, can I please invite Pravisha, who is the regional consultant with UNAIDS and WHO, working on innovative testing and virtual interventions, to go through the WHO guidelines on self-testing. Pravi, over to you.
Good afternoon, everyone, and thank you so much, Midnight, for this opportunity to share the testing guidelines by WHO. I can't see my slides on the screen. Okay. Okay, thank you so much. So today's presentation is going to focus on some global updates on HIV self-testing, some of the recommendations by WHO, and we also have a few lessons that we've learned over this time and how we can improve our programs now. Next slide, please. So as we all know, as we've been working in the HIV sector, we would know that testing is a major gateway to services. So once you bring a person into testing, we then divert the person depending upon the needs and preferences to prevention or treatment services. And it's extremely important that testing be offered to the person as they would like to access it. Next slide. WHO recommends a mix of HIV testing approaches, and I'm sure all of you are aware of all of these. But I just wanted to quickly go through these because it is extremely important to understand the exact way of testing. And facility-based testing is mainly where we go to a facility and get tested, that is going inpatient or going at a facility and getting tested. Community-based testing is mainly when peer workers or outreach workers go into the community and test the populations there. Provider-assisted referral is when you want to refer a spouse or a partner or a sexual partner or an injecting partner, and you take assistance from a provider to refer that client for further testing. Social network-based approaches are when we select a positive client or a negative high-risk client to move into their unknown networks, whether it is sexual injecting networks or social contacts as well. And HIV self-testing is when we offer self-test kits to clients to test themselves. Now, this can be through an oral test kit or a blood-based test kit. Next slide. So just to come on the same page with everyone, self-testing is when a person collects his or her own specimen, performs his or her own test, and interprets their results. When test results are reactive, then the person needs to be linked to confirmatory testing, or if it's non-reactive, then the person can be called for a further test or given a self-test kit for future tests, or can be continued for prevention activities. Next slide. So as mentioned, when there's a reactive result, we obviously will need to link the person to confirmatory testing, because as we know, HIV self-testing is a screening test and cannot be confirmed positive until and unless we have confirmatory results. And non-reactive test results would then be moved on to prevention so that we ensure that we keep the person negative. Next slide. Self-testing and self-care have become extremely important as far as HIV programs, or rather any program is concerned, because it is extremely important that we give that choice to the person who wants to access the service. And today, self-care has become extremely, the need of the hour, I would say. People want to access services on their own, in their own preferred manner. And self-testing is one such example of self-care, which would include self-sampling, self-screening, self-diagnosis, self-collection, self-monitoring as well. It's important that we ensure that services are available to the clients the way they want to access it. Next slide. Next slide, please. And self-testing and self-care, therefore, is extremely critical to our system as well, because it increases engagement and autonomy. It increases access and equity. It also helps us to improve quality of care. It increases efficiency, because we already know that our health systems are burdened with a lot of populations. And with sorry, can you please go back to the previous slide? Yeah, thank you. And it increases efficiency, because we are going to reduce the burden on the healthcare facilities if we roll out self-testing to our populations. It also obviously reduces costs to health systems and individuals, because we are going to cut down the travel costs, we are going to cut down human resource costs, etc. Expand the universal health coverage efforts. It's extremely important that we move towards this direction, and that's how self-care is extremely critical to our systems. Next slide. Just a short overview of the timeline of how we've moved across the self-testing policies. In 1986, the first HIV self-test kit was discussed. I'm not going to go through everything in detail, but just highlighting a few important ones where in 2016, WHO recommended self-testing for the first time. Thereafter, we've had multiple versions of recommendations and policies and guidelines on testing and self-testing. And recently, we also have expanded to various other types of self-testing like hepatitis C, STI. We don't have a full recommendation yet, but it's coming. And then we also have COVID, as we all know. Next slide. So WHO's recommendation on self-testing as per the 2019 recommendations has been very simple, that self-testing needs to be used for people who are most at risk and who would otherwise not come to a facility to get tested. It should be offered as an additional approach to HIV testing services. Next slide. It's important that we focus self-testing to a particular set of population if we want to increase our diagnosis and if we want to increase the number of people that we want to bring into testing. And it is extremely important that we reach the largest possible number who remain undiagnosed. So we would want to use self-testing as an approach to reach the unreached populations, the non-identifying populations, the hidden, more discrete ones, those ones that are not ready to come to a facility, but if offered a self-test kit, might have an opportunity to know their status. It increases in increasing acceptability, equity, and demand for those that have been left behind, including all key populations, ensuring cost effectiveness, greater efficiencies for health systems, and also the users. It also helps us to achieve the 95-95-95 goals, and also facilitates linkage to treatment for individuals who test HIV positive or reactive, and also appropriately prevention for those who test non-reactive. Next slide, please. So just to give an example of where to begin if you want to roll out self-testing in your program or your country, there are various different population groups that you might want to prioritize. So on the left side, you can see a few priority populations like couples and partners, men, key populations, young people, and other risk populations. In the center, you see all the approaches that could be used to reach any particular population that you want to prioritize. So next slide, please. So I just wanted to give you an example. So if your priority is all key populations, you could use community-based self-testing, you could use pharmacies and kiosks, internet and apps that are extremely popular nowadays can be a great way of reaching people and offering them self-test kits. Vending machines have been used in many countries for offering accessibility to self-testing, and then also integrated in key population programs. It's extremely important to integrate self-testing as part of the testing approach, and not run it as a parallel program. Next slide, please. Another similar example is for men. We often miss out men as a priority population, but I think it's extremely important that we reach out to men in general and also understand their needs and preferences for accessing services. And there are some specific approaches that have been used in different countries and have been successful for men. And we can obviously, these are extremely flexible, and you can adapt them based on your country context and formulate a model of using self-testing for your priority populations. Next slide. So self-testing is often used for increasing case finding, and it can be used for high HIV burden settings. It can basically replace screening tools in other facilities. It could also be used for it could also be integrated into family planning and STI clinics. It has been used as part of the community outreach, where we share self-test kits with the community to enable them to test their partners or their spouses or their social networks. Secondary distribution like index testing and social network-based testing are extremely important today, and self-testing can play an extremely important role and can be a game changer in order to bring more undiagnosed, new and discrete populations into services. Next slide. It is also a very important part of prevention. I think now that WHO recommends self-testing for PrEP as well. I think one of my slides also covers the new recommendations, and I'll be speaking about them in a few minutes. But WHO now recommends PrEP initiation and continuation. It also recommends it for PEP. And also for partner testing, also to co-package it with other prevention or combination prevention approaches such as VMMC, condoms, harm reduction strategies, etc. Next slide, please. So as I mentioned, in 2022, WHO also released a guidance on using HIV self-testing for PrEP. And it can be used in different ways depending on how the client wants to make use of it. So as prescribed, which is every 3 months, often which is linked to refilling of PrEP. It could be used as needed. So you can use a self-test kit to restart or start PrEP again. And it also can be used as desired. So if you feel that you still want to go ahead and get yourself tested between visits or refills, also you can use a self-test kit to test yourself at any point of time. Next slide, please. There are a variety of support tools that are also available online and offline with regards to usage of self-test kits. There are in-person demonstrations that are available in facilities. There are demonstration videos. There are telephone hotlines. There are messages on social media and dating apps there are various creative campaigns that keep going on. I think APCOM has a few as well, where you keep getting awareness and information about how to use self-testing for PrEP and also for testing yourself and knowing your status. Next slide, please. Some of the latest WHO evidence shows that a variety of distribution models have been seen to be successful across populations. Online and mail distribution has also seen that there has been an increase in uptake of testing as a whole amongst key populations. Self-testing more than doubled testing frequency as compared to standard testing services. It also doubled positivity among key populations. No difference was found in linkage to care, which I think is a worry of many programs and populations and communities also, but no difference was observed. And it is extremely important that we involve peers and community as part of designing a model around self-testing. Next slide. We've also seen that there have been no reporting of suicides or social harm, and there has been no difference in uptake of or frequency of STI testing, no difference in condom usage. Cost and cost effectiveness, of course, would vary depending on the country context, and it can be extremely empowering for users and our communities. Next slide. This is just a cost analysis of testing as a whole. It just does not cover one single test, but rather an entire testing range, right from self-testing to a confirmatory testing. And we have given a range of low to upper middle income countries versus high income countries. And there are ranges which would give you an idea, and you can adapt this based on what approach you use for your country and priority populations. Next slide. There are 6 self-test kits that are currently pre-qualified, are WHO pre-qualified. 5 are blood-based test kits and 1 oral test kit. We now have a $1 test kit that is also available, which is the cheapest so far, and it can be used by countries, very efficiently for communities. Next slide. Just as an update, 98 countries have policies supporting self-testing. 52 out of them are routinely implementing. Next slide. But as we see Asia Pacific, we are still low in terms of number of countries that are implementing self-testing. Only 20% of us implement self-testing so far, and we still have a long way to go. Next slide. Global Fund also now has included self-testing as one of their key program essential, and every country that accesses Global Fund would require to add self-testing as part of their program. Next slide, please. WHO also has a recommendation, a similar recommendation for hepatitis C, self-testing, where the same process is followed as HIV. Linkage to confirmatory testing would be required if the client tests positive. If the client tests reactive for HCV self-testing, or they can be linked to other prevention strategies and approaches. Communities, including networks, etc., need to be effectively engaged while planning HCV self-testing approaches as well. Next slide, please. We also have an upcoming syphilis self-testing recommendation. We don't have a full recommendation yet, but it's coming. And it's important to understand that a lot of research, a lot of reviews, systematic reviews have been undertaken. And we found that, there has been a greater testing uptake. There has been no significant difference in test reactivity, no significant difference in linkage to confirmatory testing as well, and no social harm, no reporting of social harm or adverse events have been seen. There also has been a high acceptability among different populations, and costs has also been lowered per person getting tested. Next slide, please. Can you go to the previous slide? Okay. Sorry, I think I'm missing a slide somewhere. Okay, next slide, please. I also wanted to speak about virtual interventions. It's important that we understand the way in which populations want to access services today, and virtual interventions are one such strategy in which people want to access services. By going virtual, we are not only reducing the burden for the facilities, but also enabling self-care options for clients. 4.95 billion people use the internet today, out of which 4.62 billion are active social media users. So that's exactly where we need to be in terms of offering services to people and also bringing them into services. And 2.5 hours has been notified as people using social media. I think this is a very low average. I would say 7 to 8 hours minimum. I use 7 to 8 hours of internet or social media on a daily basis. So I think I'm sure that communities and populations are doing the same. We also have an opportunity to reach a broader population through virtual interventions, because we are not just restricting ourselves to key populations that we find offline, but also the more hidden non-identifying populations who don't identify themselves as key populations, but are vulnerable and in need of services. It also offers choice for differentiated service delivery for clients that want to access services online. It improves efficiency, lowers costs, and is also low time consuming. Next slide, please. There is a policy brief on virtual interventions that was released by WHO and UNAIDS last year at the AIDS 2022 in Montreal, which mainly provides an opportunity for countries and programs that want to scale up or use virtual interventions as part of their programs. It gives an opportunity for countries to learn the different approaches under virtual interventions. We also have a framework that they can use to adapt to their country settings. We have some case examples that would help them understand what kind of virtual interventions can be used and how they have been successful in other countries. Safety and security guidelines are also included and also have a link to costing guidelines. Next slide. Just wanted to give an example of using self-testing on a dating app. So Grindr has started promoting or distributing self-testing kits on their app. This is currently only in the US, but it's slowly being expanded to other countries, and you can get in touch with Grindr if you want this in your country as well. So this is a program where you can straight away order a self-test kit online on Grindr app, and it will be delivered to your homes via courier. Next slide, please. There's also AI or artificial intelligence that's coming up in a big way now, and it's extremely important that we integrate that or leverage that as part of our programs. This is an example of a pilot program in Kenya where an AI app actually helps the client to interpret their self-testing results. This is not only used by clients, but also can be used by healthcare providers to interpret the results in a better and a faster manner. And then this AI app also gives you information about self-testing. It also links you to confirmatory testing and also to PrEP in case you are found to be non-reactive. Next slide. Some other examples from Vietnam where we have a differentiated self-testing strategy. It depends on the client, what kind of self-test kit they want to access, how they want to receive the self-test kit, and what kind of administration, whether it is assisted or unassisted. Next slide. Another example in Vietnam where the self-test kit is delivered through Grab Express. Grab Express is a food delivery app, but it is used for delivering commodities like condoms and self-test kits and even PrEP now. Next slide. Next slide, please. This is also a self-testing platform where we also initiate, offer PrEP to clients. And so we see that there has been an increase of PrEP initiation once the client has tested themselves through self-testing. Next slide. We also did an online survey where we asked how many clients would like to use self-testing before they initiate PrEP. And I think a large population said that 95% of them said that they used a self-test kit at home before they initiated PrEP. And then 96% also said that they would like to reuse self-testing the next time they want to initiate PrEP as well. Next slide. Next slide, please. Next slide. Before I go on to the lessons learned, I think there was an important slide that I think has been missed in this deck, but I just wanted to announce the new WHO recommendations that was just released this year at the IS 2023 in Brisbane, which spoke about HIV self-testing, which can be offered as an additional option for testing at facilities now. We were initially saying that self-testing needs to be, distributed to communities either by community-based approaches or through courier, etc. But we are now also saying that self-testing can be distributed at the facilities. HIV self-testing can also be used for PrEP initiation as well as restarting PrEP. And then also self-testing, social network-based testing approaches can also be used for a broader population apart from key populations also. So these are the three key new recommendations by WHO, and there is a web story on the WHO website. I'll put it on the chat and you can access that. Quickly going on to the lessons learned, I think self-testing is the new normal, and it's extremely important that we expand self-testing scale it up to other regions if not already done. It's an important self-care option, and we need to ensure that our populations have access to self-testing kits, not just for themselves, but also for their partners and other social networks. Extremely important to have policies and quality assured products, ensure access, implementation, availability of affordable self-test kits, and advocacy is still important because we still have a lot to do in terms of convincing programs and national stakeholders to include self-testing as part of our programs. Next slide, please. I would like to thank all the team at WHO for these slides, and thank you very much for listening, and I'm open for any questions. Thank you.
Thank you so much, Purvi. That was very comprehensive. It's great that you stressed that the self-testing, you still need to do the confirmatory testing as well. So it doesn't take away from that process. The stress about this is offering people choice. options and empowering the community to actually take an active part in terms of getting the communities to know the HIV status. You mentioned about like in our region only 20% really that's so implementing HIV self-testing. Could you tell us a little bit more about why are some of the countries in our region a bit slow to get this moving along?
Thanks, Midnight. That's an extremely important question. I think majority of the countries are still struggling with registration of kits. Most of the countries do not have a kit registered in country, and that is why they are not able to move beyond studies and pilots and not able to scale it up to other regions and other populations. So I think that is one of the major barriers that countries are currently facing. Thank you.
Thanks so much, Purvi. I think that I got a question for Dr. Guide as well in terms of similar in terms of what is USAID actually doing around getting the approval for HIV testing kits in our region. Can you please give an example of what you've been doing? Thank you.
Thank you so much, WHO and Kun Midnight. I can provide some example of how we endorse the HIV test kit or HIV self-test into the countries, which this is the example from Thailand. Actually, follow the 5x3. The last strategy is follow the science. Before we can implement anything in Thailand, for example, we need to do multiple studies, and during 2017 to 2019 USAID support FHI 360 to study oral fluid HIV testing, and after the study the country endorsed the oral testing under the global fund funded mechanism, which Global Fund procured the oral fluid to implement as a normal service, routine service, not for a study anymore. And after that, After that, during 2019 to 2020, USAID support the country in developing the national guidelines. The national guideline developing after the two manufacturer of the oral fluid and instant HIV self-test had registered with the Thai FDA, and the Thai National HIV Strategy Committee, they start to develop the guidelines for HIV self-test. And then last year, the National Health Security Office endorsed the guidelines and the HIV self-test into the Universal Health Coverage Scheme. Coverage it means that every Thai population can have test kit for free twice a year. So this under the benefits of the universal health coverage. So this is in Thailand, we do like this, and right now the benefits from the National Health Security Office, they implement in multiple ways, directly to the pharmacies network or to CBOs or to the hospital. However, from USAID funded CBO side, we have implemented HIV self-test for 2 years already via the community-based organization system. We still have many barriers to overcome, and we talking about how to analyze the root cause analysis of the barriers of the scaling up of HIV self-test, which in the way. So next time, if we have a webinar, we can share that what is the barriers, because it's like prevent Thai population to access the test kit. In terms of the regional, we support UNAIDS regional support team to through the UNAIDS for sustainability programs, which focus on S&D reduction, which we thought that HIV self-test or any kind of test or HIV service could not scale up because of the stigma and discrimination in the community level, or internalized stigma discrimination, or healthcare facility stigma discrimination. So we thought that this is very is the important barriers to prevent client to access to test kit to HIV testing. So we support UN. So this year we still support in this. So this is example. Thank you so much.
Thank you so much, Dr. Pinpanita, for that very comprehensive answer. I mean, it already demonstrated quite complex processes in terms of getting the approvals at the governmental level. And you mentioned about there is a need to coordinate between different donors to ensure that not just about the approval of the kits, but ensuring that it actually goes to the community-based organizations or through the community-led services that then can distribute these test kits to their communities as well. So I think that's where we really need the support from the technical partners and donors to ensure that this is well coordinated, and ensuring that the community can also be an active then taking active role to ensure the scale up of HIV self-testing to their communities. Dr. Bora, I do have a question for you, sir, if you don't mind. As Provi mentioned about the online, particularly for our region is young key population, and in Cambodia you're doing very well in terms of the reach, even though there are still some issues that you want more the demand generation. Can you talk a little bit more about the how you're targeting the HIV self-testing for the young key population within Cambodia?
Yeah, thank you, Midnight. It's a good point that Cambodia have introduced the virtual for HIV testing among KP since that COVID outbreak time up to now. And actually, we have a CBO who are working on that, and we divide in the group of those CBO area who are responsible for the community or part of KP group that under CBO for provide regular testing, provide provide another information related to STI too. So for a clear point or movement for that, I have my team here. So Dr. Kum Hai, you are here too, right? So you can explain a bit what that Midnight mentioned. Kum Hai or Bong Pa?
Yes, please, also have to answer the question. Thank you, Midnight.
Dr. Bala, sorry, that I maybe can bit more question again, sorry.
So the question is, what are the strategies that Cambodia has implemented in terms of reaching the young key populations on HIV self-testing?
Yeah, thank you. Currently, we have like a more strategy that how to reach young people that we use by the first that we can reach their team is for virtual, and for virtual, yeah, they can reach with any acting app like Grindr, Facebook, or any that they can reach. And another strategy is reach through their PDI plus, because they can reach by peer, they can know they're at the community well as well. And some they can reach face to face at the community also. Yeah, and more more importantly that the outreach worker, they can them at night time, that they use that we call mobile van at night time. They can work from 7 a.m. until 12 p.m. Yeah, sorry, 8 p.m. until 12 p.m. Yeah. So then mostly that I go at night time, so the outreach worker that easy to reach them. So when Dr. Bara asked Dr. Bara present that you see that the HIV testing among that the night time is more more finding, yeah, than face to face. Yeah, thank you. Come Hai, you have any
thank you so much. Oh, Kim Hai wants to add. Okay.
Yeah, thank you so much, Minai. I would like to add some, and thank you, also answer some question. And another way, we also work with the community. Also, they conduct face-to-face outreach activity to meet with high-risk group, street-based, and also work with key influencer through social media promotion. And also we conduct event activity regular basis by technical support from APEC, and also the CBO conduct by themselves, organize the event, for example, Pride Month and pop-up event, and including other promotional material to make sure the key population, the high-risk population, aware about HIV, where they can conduct HIV tests. And also recently, we also introduced online reservation, so they can book for HIV testing, including PrEP and ART as well, based on the need and where it's located near the community, they can access those services as well. Yes, that is all from me. Thank you.
Thank you so much. And I see, Pauline in the chat as well to, give some other examples of what is happening in Cambodia as well. Kim Hai, is that a new hand? Do you want anything to add? Outside old hand.
No, old hand.
Oh, old hand. So feel free to please just share some of the more experience in the chat box. I'm afraid that we're running a little bit behind the time, so I don't want to keep our other presenters waiting to share their country experiences. So we have in the next session Indonesia, Laos, Malaysia, and Thailand, sharing their country experiences. So without further ado, I'd like to invite Yusuf Nugroho from the Spiritual Foundation in Indonesia. Yusuf, over to you to share your country experience.
Okay, midnight. Thank you. Hi everyone. Good afternoon. I'm Yusuf from Spiritia, one of the PR communities in Indonesia, who manage CBS as one of the strategies for increasing number of the HIV tests in MSM, transgender and IDU. Next slide, please. Yeah, the outline for this presentation will discuss about why Spiritia doing CBS strategy and CBS implementation in Indonesia, and lesson learned and recommendation. Next slide. Next slide, please. Yeah, thank you. Legal basis of CBS strategy is referring to the regulation of the Minister of Health in Article 5(b) concerning the improvement and expansion of public access to comprehensive and quality of screening, diagnostic and treatment services for HIV, AIDS, and STI. Other that, to answer the programmatic gap, especially the gap from test and treat, as we know, target achievement from estimation for PLHIP. Know their status only 79%, and PLHIP on ART around 64% in 2022. Before, slide before. The previous slide, please. Yes. In Indonesia, start from 2017, Piritia conduct the research on CBS only for MSM population in Jakarta, Surabaya, and Denpasar. And in 2021, the OFT support from SAR3, we conduct implementation research for MSM, TG, and people who injecting drug population. And 2022 until now, we do implementation of CBS in 126 districts of 159 district intervention Piritia. Next slide. The difference between the 2017 study and 2021 is in number of population, number of districts, and in 2021 we using web-based to assess strategy in COVID situation. Now we back to use outreach worker base, so the population can ask the outreach worker for OST by face-to-face or using online with media social. Next slide. The result from study in 2017, respondents who use OST as generally answer OST is easy to use. And the lowest is because just curious, so they want to use OFT. And respondents who reject OFT generally answer because uncomfortable place or situation, maybe because COVID. And the lowest answer is because the outreach worker are less convincing. Next slide. Result in 2021, the positivity rate for MSM is 4%, but those who conduct confirmatory tests are still low, only 34.4%. And next slide for TG result. Confirmatory test is also still low, or less than 30% from reactive CBS. And in PWIT is lowest than next slide. For PWIT is lowest than MSM and TG population, only 10.8% who come to confirmation test to health certificate. Next slide. In 2022 and 2023, implementation until first semester in 2023, we can see a significant increase in confirmatory test, become 63 in 2022, and increase in 2023 become 75.5%, and refer to ART 81%. For TG in the next slide, also increase in confirmatory test, become 70% in 2023. And for IDUs, is increased but not significant. And in 2023, the confirmatory test decreased, become 21% from 48% in 2022. Next slide for challenges. There are still constraints on the supply chain mechanism because in 2022, the OST stock is lower than target, and OST is still unregistered in Indonesia, so procurement is still from abroad and using special permit. We using research to permit for OST can come to Indonesia. Next slide. Lesson learned. OST should be registered and government can accept as a test kit, not only for screening. Indonesia have a registration for test kit only for blood, not for saliva. And need to sharing cost between donors and the government to OST procurement. That's all, guys, for lesson learned from Spiritia, and thank you. Over to you, Midnight.
Thank you so much, Yusuf, for very good presentation on what's happening in Indonesia around HIV self-testing for key populations. Colleagues, if you have any questions for Yusuf, please do just write that into the chat or the Q&A function. And then we'll come back after all the presenters, and then we'll ask you the questions, if that's okay. Next presenter that I'd like to call upon is Thailand. I apologize to go off script because Kun Gritapon Termwanit is going to be in another meeting, so if it's okay for her to come on first. So Gritapon and Termwanit is the Communications and Marketing Manager at PEPFAR Clinic from the Institute of HIV Research and Innovation in Thailand. So please, over to you to share your experience. Thank you.
Thank you very much, Kun Midnight. And sorry for other speaker that I have to cut in line for this. I really need to go after 3:30. Okay, so thank you to the organizer as well for allowing me to talk about our HIV self-testing service at PEPFAR Tangerine Clinic. But before I go to the service itself, I would like to give you a little bit of context of the clinic. I think many people have heard of Tangerine, which is the first transgender specific health center in Thailand, established in 2015, so almost 8 years ago. So when we moved Tangerine to the new facilities, we also established PEPFAR Clinic in December 2020 and put it together to become PEPFAR Tangerine. PEPFAR Tangerine is a one-stop sexual health clinic for all, and the services are designed to meet the target client's needs. That is to say, fast service delivery, easy access, and a space without stigma and discrimination. So at the clinic, we have a team of experienced professional health workers, and we offer a wide range of services from screening, testing, treatment, and prevention, including gender-affirming care for trans population. And to ensure our services are accessible and convenient to all, we also offer telehealth services, which include medical consultation and medical delivery as an option for clients who prefer digital platform, and which I will talk more later on the HIV self-test linkage to PrEP. So since we operated this is as of December 2022, we have served almost 8,000 clients. Today, it would be almost 10,000 already. And most of our majority of our clients are MSM and trans women. However, we also receive cisgender population that almost 30%. So I think we should not leave them behind. There are some health issues that we need to address for the cisgender population as well. So at the clinic, we provide free HIV self-test kits, which is funded by USAID EPIC project to those who express interest in exchange for their test results, in exchange to their test result and other data. And furthermore, we also have 3 different HIV self-testing products for sale. The approach that we use to provide the service is a people-centered, status-neutral approach in order to emphasize high-quality care, to engage and retain client in services, regardless of its service. For HIV treatment or prevention. The service was simplified to deliver HIV self-test kits to those who are interested. If they return the non-reactive result, they will be offered with PrEP to maintain their negative status. And this include PrEP restart and follow-up as well. If the results are reactive, a confirmatory testing will need to be done on site. We believe that this service can be another choice for those who find online platform more convenient and confidential. And certainly when it comes to our PrEP service, we offer clients with the option of receiving an HIV self-test kit. If they're interested, we also provide the chlamydia and gonorrhea self-sampling collection kits. So once a client shares a negative result test with us, we extend the offer for PrEP services. And in terms of STI for chlamydia and gonorrhea, as soon as the clients complete their sample collection, we arrange a messenger service to collect the samples and to get back to the laboratory for the testing. And subsequently, we promptly inform clients of their test result. And for our existing PrEP user, we include an HIV self-test kit in their refill orders. And additionally, we also, promote and maintain communication with clients to ensure that they have scheduled visit to our clinic for any other required additional lab tests. So for our free distribution, after operating for almost a year now, or actually a year and a half now, we have provided a total of 701 HIV self-test kits. 507 clients received the kits and sent the result back to us. Is worth to note that around 35.7% never received HIV testing before in their life. And of these clients, the majority are MSM and trans women. Interestingly though, cisgender women make up to 12.4%. It captures our attention, and we speculate that women might be more inclined to avoid traditional sexual health clinics. So making this service a good option, particularly appealing options to them. And among 507 clients who submitted their result, we found that 31 reactive results, and 80.6% of them received confirmatory HIV testing. 81% confirmed HIV positive, and all of them received treatment on the same day. So the case finding rate stands at 3.7%, but the HIV prevalence among non-PrEP users is at 4.9%, which is higher than the rate observed at our facility-based testing. And of those who returned their non-reactive result, 42.2% of them received PrEP services. And I would like to point out that 45.8% of those who receive PrEP services are new PrEP users. We also see 5.2% of our HIV self-test clients accepted chlamydia and gonorrhea self-sampling collection as well. And 90% of those returned their samples. And we found 16.7% reactive results. And subsequently, all of them received the treatment. And for the HIV self-test kit for sale, we have 3 products, like I said earlier. And since we started, there are demands for 63 kits for InStay, 133 kits for eye care. The first 2 are blood-based, and All Quick is at 83 kits. For those who purchase HIV self-test kit from our clinic, we did not follow up for the result, but they can reach out to us for further, linkage to treatment or prevention at any time. So what we have found after implementing this is that there are more invalid results among transgender women clients than others. But we are not quite sure why, but it could be the complication of the instruction of particular product that they shows. And also the case finding rate among trans women is higher than MSM. And this could be interesting strategy to enhance our reach to those that we couldn't reach before among trans women. But for MSM though, they tend to use HIV self-test to receive PrEP service more than others. And lastly, 1 in 3, like I said earlier, 1 in 3 of HIV self-test clients never received HIV testing before in their life. That means we could use this as an effective addition to the strategy to reduce new HIV infection, and eventually it should help with the first 95 as well. And to conclude, HIV self-test could help enhance the access to the sexual health services, especially those who we could not reach before. And HIV, I would like to emphasize that HIV self-test is a choice. It's a choice for those who see this as a more convenient and confidential option that fit their lifestyle. It is not to replace a traditional testing method. It is actually will help the system to achieve the universal health coverage at the end, and eventually the health equity, which is more important. And what we need is also the national endorsement in order to guarantee the access to HIV self-test, its availability, and also the affordable price in order to scale up a self-test. Like Greg's guide said earlier, that Thailand will implement this very soon, that the national health security system will endorse this as a part of benefit for all Thai. However, the promotion of this benefit should be also made nationwide, so people know that where they can get it and that they have that right to have HIV testing for free at home. Thank you.
Thank you so much, Kun Ketaporn, for that very interesting insights, particularly the last 2 slides. I know you're about to go, but can I just ask you a quick question around the results you found for transgender women? Was that was that preferred blood-based testing or oral fluid that the transgender women at the clinics were preferring?
Sorry, can you say that again, please?
Yes, for the findings for transgender women for self-testing, is that blood-based or is that oral fluid? Yeah.
The one that we distributed complementary is only blood-based, because that's the one that we use to link to PrEP service. Yeah.
Thank you, and I know you have to go, but if there are any questions that we have for IHRI, then I'll certainly send it to you, and then we can help send the answers back to you. You have anything else? But I know if anyone want to kind of have a look and come and visit the Tangerine Clinic, PEPFAR Clinic, yes, please do get in touch. They're very good, and always welcome to get the communities to come and see what they do.
Thank you very much.
Thank you. All right. I'm so sorry. I think we're gonna run over another 15 minutes to be able to hear from Laos and Malaysia. If you indulge me and our team, I'd like to invite next from Laos, Udon Supawan, who is the EPIC manager from Laos, to share experience. Udon.
Hello, yes.
Sabadi, we can't see you.
Wait, can you see me?
Yes, we can now.
Yes.
Great.
Thank you, Kun Midnight, and good afternoon, everyone. I'm Udon Supawan for EPIC Laos. Today, I could not see the slide. So I would like to share with you about the HIV self-testing for page distribution that we initiate from last year for about 9 months. Kun Midnight, can you share the screen?
Are we already sharing? Can you not see? Just tell us when you want to go to the next slide.
Yeah, I see the slide now.
Yeah.
You
So
see the
Don, right
slide?
now it's not HIV paid distribution, and then you have the
Okay,
next
next slide, please. HIV, we provide the services for 9 months from September 2022 to May 2023. That we have test kits supported by USAID, and then we found that we provide the 3 clinical to pilot or initiate in Vientiane capital that link to the ART center that we just do the very small clinic or pharmacy in Vientiane capital. So we distribute 120 test kit, and then we found that the pharmacy or clinical can sell out or can give to the client to hidden key preparation to among MSM and transgender women that they come and buy in the pharmacy 112 test kit, and then the number of tests we have 68 test kit, and we found 5 cases HIV positive in during this time. Then we refer them for client to do a confirmatory test at ART, and then now they are provide care and treatment already. So next slide, please. So achievement of this small initiation, that as we observe that it is possible to extend this new service option into community. The hidden KP prefer to access quiet HIV services. This is service option can reach both KP and general population. So thought this initiation, EPIC risk for case finding and confirm HIV positive. 1 of 4 person can confirm HIV positive is a woman, and then 35% of risk people is MSM and TG, and then 3 out of 4 HIV positive case are MSM. Next slide, please. Our challenging for HIV page distribution service, client is hesitate to provide a personal information, as we need to track testing result. For example, if they come and get the test, and then we have difficult to find information when they go back home, and then we need to find a lot of channel from telephone number or Facebook or messenger, any contact number with them. Some client disappear after getting this test kit, it was difficult to track, and some people that they don't want to tell us the result, and then they block the number of the healthcare provider who sell the test kit, and then they not contact with us. So as HIV self-testing pest distribution is new for Lao country, it is not yet properly disseminated to community people. So there has not distribute. We are still new, and then we learning, and by doing on this activity. For now, we still not continue yet because the test kit is run out of test kit for now. But we have another private company that they are still importing the test kit and will sell in Vientiane, and then we recommend 3 clinic to continue with that company if they want to continue to distribute test kits in the clinic. So this is for our Lao is very small thing, and that's all for my presentation. Thank you.
Oh, thank you so much, Udon, for sharing the experiences from Laos. Even though you said it's small, but I think it's very significant to kind of get those data. Any questions for Udon, please type into the chat box. But then thank you to Kenny Yap, the country liaison and trainer for the Malaysian AIDS Council for holding on to be with us. I'm so sorry that we running a little bit late, but I'm glad that majority of people are staying on to listen and hear the Malaysia experience. Over to you, Kenny.
Hi everyone, thank you Midnight, and thank you everyone for still being here. I know we're all I know we are a little bit late and running behind time, so I will speed up the presentation from Malaysia. Could we have the slide up, please? There we go. So hi everyone, I'm Kenny, and I'm the country liaison and trainer for Asian Harm Reduction Association, an initiative from the AHRN, and we are part of the Malaysia AIDS Council. Today I'm going to share with you about our initiative on self-testing called Jom Test. We started this pilot in November 2020, and it was with the Center of Excellence in Research for AIDS from University of Malaya, and also us, the Malaysian Council. And next slide, please. And the program was made possible by the funding from SKIPA and Global Fund. And since 2022, it was fully funded by Global Fund. Next slide, please. So the vision of this program was a society free from negative impact of HIV and AIDS, where the AIDS epidemic is under control through comprehensive prevention, treatment, care, and support, and the impact of alleviation services, particularly for the most vulnerable and marginalized population. And our mission is to represent and mobilize and strengthen non-governmental organizations and communities to ensure political commitment and effective response in a supportive environment at national and local levels. So in our efforts to scale up self-testing, we work in partnership with the government, private sector, and international organizations and people living with HIV. Next slide, please. So I'm not going to share a lot of data today because I was told to share our experiences and our lesson learned from this program that was being implemented since 2020. And one of a few of the challenges that we came across from the user itself was they found it that the signing up process for this platform was very extensive and too complicated, and there was a lot of technical errors that occurred in the user interface. And then there was also a long waiting duration for test kits because we started this in the duration of lockdown, and we had some challenges trying to deliver test kit to our clients and participants. And then there was a lack of versatility in service provided in terms of linkage to care, and also in terms of psychosocial support and counseling. Our users also found that it was difficult in obtaining support in terms of technical errors because it was run at a pilot project at the time. We had a limited resource of human resource to get back to our clients in terms of technical support. And then in infrastructure wise, our clients could only order up to 2 times every 3 months apart. So they had to recreate new accounts if they wanted to order more than twice. And then there's no automation in our website, and it was only available in 1 language. And there was no follow-up services and referral systems and information. Next, please. And then some of the other challenges we faced was like there was no system for clients who got tested either negative or positive or invalid for the next step. So they were stuck at the stage of wondering, what do I do next? And as well as no available services for referral. And then we also started out small, so we only had 1 single channel for dissemination, which was through our own social media and sharing with the other our partner organizations. And none of them was involved in this project. So how did we overcome that? Was next slide, please. So we recently upgraded the website system to address a few of these challenges that was mentioned to us by our clients and our end users. And we decided to make the registration process even shorter, just using a 2-step process where it's registration and your address and your consent, and that's it. And the questionnaires that we used to use for behavioral indicators were no longer compulsory. So users now are able to get the test kits without needing to fill out questionnaires or surveys. And we are pleased to announce that the website is now available in bilingual, the Malaysian local language, and in English as well. And we hope to develop in 2 other languages in the future, which is the Mandarin and the Tamil version. And then it's now more concise with minimalistic design, and it's suited for mobile apps. I mean, it's suited to use on your mobile web browser. Since we do not have funding for a mobile app yet. And then we now have real-time delivery update where it will directly send to you the tracking or the status of your test kit delivery. And information that is being fed to user are based on their results, and we design the information to be shared to them based on automated pre-designed criteria. And there's more, and now we also included a referral, automated referrals to our clients at their end, where if they test negative, they will be referred for PrEP services to the primary care clinics. Or if they refer positive, we will refer them to our community health workers and our partner organizations, where they will assist them to further conduct a confirmatory test. And And then we also have a system that automatically redelivers a new test kit if you report your result as invalid. And we also generated a regular reminder via email every 3 months for those who tested negative. And also it's not mentioned here, but we also opened up for testers to get more testing instead of limiting it to just 2 rounds now. So they have a whole lot to themselves, so they can reorder every 3 months until the program runs as it is. And then we have now linkage and access to other necessary HIV prevention like PrEP services, mental health services, and psychosocial support helps. And that's all from Malaysia. Thank you.
Thanks so much, Kenny. Since you're already speaking, so I'll ask you a question, and I'll also ask one to Yusuf and also Udon as well. So Kenny, you mentioned about the I guess the funding, where Global Fund, I think you mentioned, and you started supporting. Are you getting the funding support from Global Fund in the country grant to support the HIV self-testing? And you are okay. Oh, that's great. And then it's the app that you're looking to do part of that development, because it's good to see that you learn from the first phase, I suppose, and now like you're changing your strategies, particularly going online. And how are those conversations with, I guess, donors are like?
Especially for the development of mobile apps, it's a little bit more difficult as it takes up more. It really takes up a lot of funding in terms of technical instead of being channeled into providing the services to the key population. So in terms of funding support to create that mobile app, it's been challenging. We are also looking at local domestic funding from private sectors. We've been in talks with a few of them to see how we can come together and create this mobile application.
Yeah, thank you, Kenny. Because if you remember going back to Purvi's slides, Global Fund now allows to do HIV self-testing, but I guess maybe it's just for the test kits and maybe not to this kind of the development of more online strategies, particularly for key populations. Thanks so much, Kenny. Yusuf, I have a question around like the as we know, or what we've been hearing on about Indonesia. For the criminal code, is this going to affect the way that HIV self-testing will be rolling out in Indonesia for key populations?
Yeah, we can say maybe, yeah, because we learn from the pattern of the LGBT issue, usually increase when presidential or governor election. So it's more like a political issue. So the parties can say, "Oh, I'm a moralist, I'm religious, or something." So our strategy is using a neutral language, usually not specific for MSM or gay or LGBT something. But we usually use if you have a risk behavior, so you can get a test, something like that. But when face-to-face or direct message, the outreach worker can inform well. Over to you, Midnight.
Yeah, thanks so much for for offering your thoughts on that and your strategies in light of the new criminal code. Alif, you have a question for Kenny. You can unmute.
Yes.
Yeah.
Sorry, I'm in hospital right now.
Oh my gosh, how are you?
I'm doing good. It's just that we're in the hospital. Okay, my question to Kenny. Why we can't, since you say it's self-test, why we can't access all these self-tests via, we can get all these self-tests at Guardians or 7-Eleven or any pharmacies, general pharmacies, and then from the box itself, allow us to go through the Jom test portal. Or you say, if your portal is not stable, why can't we engage ourselves with MySejahtera, the COVID portal that we've been used since 2020? So that one, they have a very good platform to access, to guide us once we test ourselves at home and where to move from there to nearest clinic or the nearest CBO, which is we highlighted there. So my question, why we don't link to MySejahtera is a COVID infectious disease as well. So question to Kenny.
All right, thank you, Ali, for the question. To answer you, first of all, Malaysia hasn't authorized or hasn't approved the medical devices of HIV self-test kit. That's because actually the guideline is the policy is still being developed with the Ministry of Health, and the devices are still, the MDA of Malaysia is still waiting for these guidelines to be published before they actually approve these medical devices to be released for retailing or for other concept use. So hopefully very soon within this year, or hopefully by the mid of next year, the policy and guidelines will be published so that we will be able to see more of these test kits in pharmacies and also at CBO levels.
Okay. So my second question.
And your second question is, sorry, can you repeat the question again? Why are we not working with MySejahtera? Actually, we are in talks with MySejahtera for the next development to have that referral pathway for appointment bookings and also client referrals through MySejahtera forms.
Okay, thank you.
Thanks so much, Alif. Gosh, I hope you feel you get better soon. And thanks, Kenny, for answering that question. I think there was similar question that was posted on the Q&A as well around, like, this should be a new normal now, particularly learning from COVID-19, right? Self-testing, everyone's doing it. And then why is it so difficult now to kind of get HIV, self-testing kits out? Yeah. Udon, then one last question to you. Are you online? I know you were talking about how in Laos there's very small numbers, but are you looking to increase the numbers, and whether the funding from EPIC or Global Fund will help you to increase those numbers for Laos? Oh, I think he's gone. Okay. I think he's gone. So apologies, Udon, not for asking you that question before you have to go. We are truly run over by like half an hour now. I do thank you all of you for staying on for these conversations and the sharing of knowledge, particularly in the last session with Indonesia, Laos, Malaysia, and Thailand. Discussions. And thank you so much for the government of Cambodia, represented by Dr. Nalbora, Deputy Director of NCHATS, for not just giving us the opening remarks, but also to share the experience of Cambodia as well, and your leadership in terms of getting, over to the 95 targets. Such an achievement for our region. Thank you so much, Purvisha, for your presentations on not just the guidelines from WHO for HIV, but also the other upcoming recommendations as well for syphilis, and the ones that you've already recommended for hepatitis C. I think we have a lot more recommendations, and countries are being allowed to take the leadership role to ensure that the communities can also be a great part of the response to ensure that we get as many people to know the HIV status as possible in a way that they like to access services. Thank you so much to Dr. Pipanita and also PEPFAR, USAID, APEC, and the team at HIVST 360 for the support for these webinars. We are all wanting to ensure that this toolkits, particularly learning from what happened during COVID-19, that our communities are able to access information in a way that empowers them as a person, and also the communities that they belong to, and that the community structures can also be strengthened through HIV self-testing as well. I would also like to say thank you to our APCOM team. If you can show yourself, Vanessa, Salvan, and Nikki, who has been really integral part of pulling through and connecting with all the speakers to ensure that we have all this information here. Those of you that have asked us around, like, are we getting the information back? Yes, you will be. The first thing you'll get is that evaluation. So please do help send comments back to us so that we can ensure our next sets of webinars can be much better and more targeted to your needs, particularly those from the community. Yeah, we'd really love to hear from you. Then we will, if you already sign up onto our newsletter, you will get the recordings, the notes, the Jamboard that participants who've been registered have sent in information around challenges and also recommendations on HIV self-testing that we've not been able to profile their country experiences here. So you can get to see what are similar or different challenges and recommendations from other countries in this region. You'll also get the PowerPoint presentations as well. So please do ensure that you sign up onto our APCOM newsletter, so you will also have those. We will also be profiling the previous webinars as well on access to ART. So if you haven't put yourself onto our newsletter, then please do so. So you will get that information as well on the previous webinar too. Have I missed anybody else to kind of say thank you to? Of course I have. Thank you to you who are still here. It's a Friday. It's a Friday afternoon in many parts of the Southeast Asia or wherever you are. Thank you so much, Rachel, for joining all the way from Switzerland in Geneva. I'm really grateful for the support at WHO HQ. Or particularly for the community empowerment. Thank you. And if you don't mind to do one last photo, because I think some people have come in later. If that's okay, if you can put your camera on, we can do one more photo. Yeah. Great. Vanessa, I'll have to ask you to.
Okay.
Okay.
Ready? 1, 2, 3. Okay, one more. Smile. 1, 2, 3. Thank you.
Well, thank you so much, everyone. Have a good Friday and also enjoy your weekend. Rest well and stay safe. ขอบคุณครับ
Thank you, everyone.
Bye bye.
Thank you. Bye.